Here is Dr. Alfred Egedovo. Hey everyone, welcome back to our channel, support by GHC Hospital Health Promotion Initiatives. Today we're diving into a topic that might not be the most glamorous, but it's incredibly important: colorectal cancer screening. Yes, I know it sounds a bit dull, but trust me, it could save your life, so let's get into it. Colorectal cancer is the third most common cancer diagnosed in both men and women in the United States, and it is the second leading cause of cancer-related deaths. The American Cancer Society estimates that there will be over 104,000 new cases of colorectal cancer and more than 45,000 deaths in 2022 alone. However, the good news is that colorectal cancer is highly preventable and treatable through early detection and screening. First off, let's talk about what colorectal cancer actually is. It's a type of cancer that starts in the colon or rectum, and it's one of the leading causes of cancer-related deaths worldwide. But here's the kicker: it's also one of the most preventable forms of cancer thanks to early detection through screening. The importance of colorectal cancer screening for individuals over the age of 45 cannot be overstated. As we age, our risk of developing this type of cancer increases, which is why it is recommended that individuals begin regular screening at this age. In fact, the U.S. Preventive Services Task Force recommends that adults aged 45 to 75 years old undergo regular screening for colorectal cancer. But why the hesitation? Why do so many people put off getting screened? Is it fear, embarrassment, or maybe just a lack of information? I mean, how many of you have heard someone say, "I'll wait until I have symptoms," which, spoiler alert, is not the best strategy? Early detection is key when it comes to colorectal cancer, as it can often be asymptomatic in its early stages. By the time symptoms such as changes in bowel habits, blood in the stool, abdominal pain, or unexplained weight loss appear, the cancer may have already advanced to a more difficult to treat stage. This is why screening is so important, as it can help detect polyps or early stage cancers before they have a chance to progress. So what are the screening options? There are several methods, including colonoscopies, stool tests, and flexible sigmoidoscopies. Each has its pros and cons, but the key takeaway is that they all aim to catch any abnormalities before they turn into something serious. But here's a question for you. How many of you even know when you should start getting screened? There are several screening methods available for colorectal cancer, each with its own benefits and limitations. The most common screening methods include colonoscopy, sigmoidoscopy, fecal immunochemical test, FIT, and high-sensitivity guaiac-based fecal occult blood test, GFOBT. Of these, colonoscopy is considered the gold standard for colorectal cancer screening, as it allows for the detection and removal of precancerous polyps in addition to the early detection of cancer. FIT and GFOBT are non-invasive tests that can be done at home, but they may not be as sensitive as colonoscopy in detecting abnormalities. The frequency of screening for colorectal cancer may vary based on individual risk factors such as family history, personal history of colorectal cancer or polyps, and certain genetic conditions. For individuals at average risk, it is generally recommended to undergo screening every 10 years starting at age 45. However, those at increased risk may need to undergo screening more frequently or start screening at an earlier age. The American Cancer Society recommends that screening begin at age 45 for people at average risk. But what if you have a family history of colorectal cancer? Should you start earlier? And what about those who are younger? There's been a troubling trend of rising colorectal cancer rates in younger adults. Why is that happening? And here's a hot topic: the debate over the age of screening. Some experts argue that we should lower the starting age to 40, while others think that's too soon. Where do you stand on this? Is it better to be proactive, or are we overreacting? Personal stories and testimonials from individuals who have been impacted by colorectal cancer can help illustrate the importance of screening. Many individuals have been diagnosed with colorectal cancer at a young age or at a more advanced stage, which could have been prevented or detected earlier through regular screening. By sharing these stories, we can emphasize the significance of taking proactive steps to prioritize our health and schedule regular screenings. Now let's talk about the stigma. Many people feel uncomfortable discussing bowel health, but why? It's a natural part of life. If we can talk about our diets, why not our screenings? Shouldn't we normalize these conversations to encourage more people to get checked? So what can you do? If you're over 45 or if you have risk factors, talk to your doctor about getting screened. And if you're younger, don't ignore any symptoms. Trust your gut, literally. In conclusion, colorectal cancer screening is a crucial component of preventive health care for individuals over the age of 45. By detecting and treating colorectal cancer early, we can significantly improve outcomes and reduce mortality rates. I urge all individuals who are eligible for screening to speak with their healthcare provider about the best screening option for them and make a commitment to prioritize their health by scheduling regular screenings. Together, we can work towards a future where colorectal cancer is no longer a leading cause of cancer-related deaths. Remember, early detection is key, so let's break the stigma, start the conversation, and take control of our health. If you found this video helpful, don't forget to like, subscribe, and share it with someone who needs to hear this message. Until next time, take care and stay healthy.